This is the skull inside the cranial cavity. Anterior cranial fossa. This is the frontal bone, and this is the lesser wing of sphenoid. Here is the greater wing of sphenoid. This is greater wing of sphenoid. This is lesser wing of sphenoid. Tell them to please be quiet. Here we have orbital plate of frontal bone. Why I'm saying orbital? Because it's related to the orbital plate of frontal bone. Then here is the crista galli. This is crista galli. This one, crista galli. Here frontal crest, crista galli, cribriform plate of ethmoid, cecum, foramen cecum. Here we have anterior ethmoidal, posterior ethmoidal, anterior and posterior ethmoidal foramen. Then we have optic canal. Here, optic canal, optic canal. This is, now we are entering into the middle cranial fossa, lesser wing of sphenoid. See this elevated rough part, like a jabal even in the skull. So petrous part of temporal bone, this rough. So this is the boundary for middle cranial fossa from here to here. From here backwards till the last part of occipital bone is the posterior cranial fossa. Now let's not confuse, and so do you know the boundaries? Now let's do the foramen together. This all is sella trachea. The central part is hypophyseal fossa. One optic nerve here, optic canal, another optic canal. This is sulcus for optic chiasma. Sulcus for optic chiasma. This is jugal, jugum sphenoidale. This is clevus. This is jugum. This is clevus. Okay? Now, I told you foramen rotundum is just, you have to tilt the skull. So just tilt it, you will find here lesser wing of sphenoid, here superior orbital fissure, and here rotundum. See, now I will show you. The pointer is in the rotundum now. Really difficult to find. The pointer is in the rotundum now. The pointer is now in the optic canal. Good?
Good. Yes.
Optic canal. The pointer is now in superior orbital fissure. It's better to see it from here. And the back is this part, superior orbital fissure. Good? Visible?
Yes.
Everyone?
Yes.
Life is easy. Life should be easy. So here is superior orbital fissure. Better to see from here, you will learn more. Superior orbital fissure, it's a long triangular space. Good?
Good. Yes.
Then again rotundum. 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 Good?
Good.
Then ovale. Let me show all the three together. Ovale, spinosum, lacerum. Lacerum. Ovale, spinosum, lacerum. Ovale, spinosum, lacerum. See here. Ovale, spinosum, lacerum. Good?
Good. Yes.
Ovale, spinosum, lacerum. Then anterior clinoid process, posterior clinoid process, pituitary or hypophyseal fossa. Then petrous part of temporal bone, internal acoustic meatus, and one here. Internal. Where is the external? Here. External acoustic meatus, internal acoustic meatus. The external ear is attached here. Then I reach into the canal. Then I will reach the middle ear. Then it will communicate with inner ear. Where is the inner ear? If I scratch, remove some part of this area, petrous part of temporal bone, there is inner ear inside. And it is very close to the exit of vestibulocochlear nerve here through this opening, internal acoustic meatus. Good? Here we have, if you are confused, sometimes you can shift it to jugular foramen, the biggest. Then the largest is the foramen magnum. Here we have hypoglossal canal. Hypoglossal canal. Let's quickly identify them on the outer side to make your life still more easy. So here is ovale, here is spinosum, here is lacerum. I told you I cannot enter into the carotid canal. So here is the carotid canal. Okay? And just behind is the jugular foramen here. Jugular. Here, certain impressions and depressions for, this is the condylar part of occipital bone, thick. See the condyles. This is internal occipital protuberance. We have an external occipital protuberance. Internal occipital crest, like frontal crest. Okay? Here, if I have the cover, here is the pterion. And here you can see some impressions of arteries inside. Not very clear. In the original skulls, of course, they are available. Especially the anterior branch is related to the pterion and it's likely to be damaged during the assaults or some street fights.
What the transverse line?
We can have a second lab for sinuses, but still, you have here this depression for transverse sulcus, transverse sinus here. It will go into sigmoid sulcus and sigmoid sinus. And see, they are going towards the jugular to drain into the jugular vein. See here, transverse sinus. Again, very quickly, anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Let me unclassify them as 3 different parts. Frontal crest, crista calli, foramen cecum, orbital plate of frontal bone, lesser wing of sphenoid, optic canal, sulcus chiasmaticus, pituitary fossa, anterior cleanout process, posterior cleanout process, foramen rotundum, foramen or superior orbital fissure, ovale, spinosum, lacerum, jugum spinal, clevus, petrous part of temporal bone, internal acoustic or auditory meatus, jugular foramen, hypoglossal canal, here and here, foramen magnum, internal occipital crest, external occipital crest, sulcus for transverse sinus, sulcus for sigmoid sinus. Finish?
Yes.
Understand?
Understand.
Thank you. This all is the spinal cord. Okay? So please, at the end. Pons. Medulla oblongata. Pons. Medulla oblongata. Level of foramen magnum. Because here we have first cervical vertebra. This is the part of first cervical vertebra. Here is the foramen magnum. Here you can see some other cranial nerves. Pons, medulla oblongata. Here is the all spinal cord. I told you in the front we have a fissure. So see here is a fissure. All this is a fissure. You can see very clearly. And this is the location of anterior spinal artery. Okay. Here you will find some cervical dilatation. Here you will feel some lumbar dilatation. the other part is almost straight. Then see this number. See, here is the conus. This is conus medullaris. From the conus you can find this straight separately going structure. Phylum terminalis. Phylum terminalis. And all other, they are known as, collectively known as caudaquila. Here we have removed the vertebral bodies, the dura mater, arachnoid mater, pia mater, everything is removed, so I cannot see any such structure. I can see spinal nerves, 31 pairs, I told you in the lecture. I can see some spinal nerves making brachial plexus. I can see some spinal nerves making lumbar and sacral plexuses. I can see some cervical ganglion. Of course, it should be here. I can see sympathetic chain, sympathetic ganglions, until they will make in the middle, center part, midline, in the lumbar region, ganglion empire, and both the chains are connected here. Good? You can see some branches for sacral plexus here. This is number one. Number two, let's coincide with this and then we can shift to other. See, here is the spinal cord, a start of the spinal cord. This is the level of foramen magnum roughly. Then I have cervical enlargement. Then it's usually cylindrical. Then I have lumbar enlargement. What is this? This one. See, it was like this. Yes, it is like dura mater. It was like this, and we open it to find the spinal cord. Is it only the dura?
No.
Arachnoid?
It must be arachnoid. Even the pia should be in adherence to the nervous tissue. So here are the meninges. I told you there are spaces, but the spaces are not so big to, as I am showing with my hands, impressions. So we have dura, then outer to dura, epidural, inner to dura, subdural. Then arachnoid, subarachnoid, then pia, and the connective, the nervous tissue. You can appreciate spinal nerves. See spinal nerves. See spinal nerves. Many of them, they are damaged or cut, but at least you can see spinal nerves. Here in another specimen, same like dura mater. Okay, where is phylum terminalis? See here.
The largest one?
The thickest one, yes, of course. And finishing in the conus. Good, here, see here, see this one. I'm not elevating in much because it's dry and it may damage. So conus, this is conus medullaris, and this is phylum terminalis. And all these are the caudaquila. Good?
Yes.
See cervical dilatation or thickness. See lumbar dilatation or thickness. Next. Okay, let's finish this one. Yeah. Vertebra. Vertebral canal. And it will make spinal canal, or you can appreciate, see, this is spinal cord, the white. See, this is anterior gray matter, posterior gray matter, lateral gray matter, lateral gray horn, anterior, posterior, lateral gray horn, white matter anterior, lateral, posterior. Central canal should be maybe obvious in other central canal. So this is actually the cord itself. Then outer to cord, we have pia. Still go outside, arachnoid. Still go outside, dura. This is epidural space. I told you some free fats and liquid fats and some vessels. So dura, arachnoid, pia, and the spinal cord, layer by layer. Clear, Shiba?
Yes.
Okay. Then
Mine.
what is this? Surely anterior ramus, anterior division. Here is the posterior division. Here is the anterior root from this point, anterior root. Here is the posterior root with posterior root ganglion. Good. The nerve is not long structure. Just both the roots, they unite, they make the nerve, and then they divide. So here you can find, can you hold it? Hold it. Here you can find posterior root ganglion, anterior root, posterior root ganglion. This is the nerve part. Then it will divide into anterior branch, this one, posterior ramus, or anterior ramus, posterior ramus. Here is the connection with sympathetic ganglion. And now it is making a sympathetic chain. Until this chain will come in the lumbar region and will make a central big ganglion empire. Good?
Yes.
Understanding? Other parts of vertebra very quickly. Body, intervertebral disc, here
Speeding.
transverse process, spine, here anterior longitudinal ligament, and inside posterior longitudinal ligament. Khalas na? This?
خلاص.
This is just to show you the start. Here is the foramen magnum. This is the level of foramen magnum. I can set someone can see in the back. Yes. Here is the level of foramen magnum. How I know? I know this part. What is this structure? This. Dens. Yes. And here is the ligament of Dens. Okay. So this is, Dens is 1 or 2? Second. C2. Yes. Here the first one in a cut part, this is the second one. So here is the level of foramen magnum. At the level of foramen magnum, I can find medulla oblongata. Just go up. Here, this is the pons. This is the midbrain. This is medulla oblongata. And here is the spinal cord. And you can see space, subarachnoid space. Good? Will it be open or no? Now here is the trick. Anterior here, wala here. So make anterior towards me to make my life simple. First, then I will make your life simple. Okay. So this is the anterior part. Anterior fissure, posterior sulcus. Anterior fissure. Grey matter, white matter. Posterior horn of the grey matter. Anterior horn of grey matter, lateral horn. Here, lateral horn is visible. Posterior horn, anterior horn, lateral horn. Central canal. Central canal. The connection of grey matter here. Anterior grey commissure, small, posterior grey commissure. The connection between. And in between there is a central canal. Anterior root, posterior root with posterior root ganglion. This is typical spinal nerve. Why I'm saying? Because still it has not divided into anterior and posterior ramus. Yeah. So in this we have spinal nerve is only this part. This is the anterior ramus or division. This is posterior ramus or posterior division. Here are the sympathetic ganglion. Here I don't have sympathetic ganglion, but I am clear with anterior roots, posterior root ganglion, and the spinal nerve. This is the point where, see, intervertebral foramen. the exit point. So this is the level of intervertebral foramen. So here is the enter point. And I told you the segmental vessels will also enter from here.
Yes.
They divide into anterior posterior radicular arteries. Here is the pathway for straight anterior spinal artery, two posterior spinal arteries, and segmental arteries. They will divide and make branches to anastomose with anterior and two posterior radicular arteries.
And feeder.
Feeder I cannot see. I can guess the feeder is usually from aorta, usually abdominal aorta. Okay, it has high degree of variations. Right side, sometime left, some here, but it has a variation. Okay, thank you very much.